Emphysema. What is emphysema? Emphysema is a type of COPD, chronic obstructive pulmonary disease. COPD is a group of lung diseases that make it hard to breathe and get worse over time. The other main type of COPD is chronic bronchitis. Most people with COPD have both emphysema and chronic bronchitis, but how severe each type is can be different from person to person. Emphysema affects the air sacs in your lungs. Normally, these sacs are elastic or stretchy. When you breathe in, each air sac fills up with air, like a small balloon. When you breathe out, the air sacs deflate, and the air goes out. In emphysema, the walls between many of the air sacs in the lungs are damaged. This causes the air sacs to lose their shape and become floppy. The damage also can destroy the walls of the air sacs, leading to fewer and larger air sacs instead of many tiny ones. This makes it harder for your lungs to move oxygen in and carbon dioxide out of your body. What causes emphysema? The cause of emphysema is usually long-term exposure to irritants that damage your lungs and the airways. In the United States, cigarette smoke is the main cause. Pipe, cigar, and other types of tobacco smoke can also cause emphysema, especially if you inhale them. Exposure to other inhaled irritants can contribute to emphysema. These include second-hand smoke, air pollution, and chemical fumes or dusts from the environment or workplace. Rarely, a genetic condition called alpha-1 antitrypsin deficiency can play a role in causing emphysema. Who is at risk for emphysema? The risk factors for emphysema include smoking. This is the main risk factor. Up to 75% of people who have emphysema smoke or used to smoke. Long-term exposure to other lung irritants, such as second-hand smoke, air pollution, and chemical fumes and dusts from the environment or workplace. Age. Most people who have emphysema are at least 40 years old when their symptoms begin. Genetics. This includes alpha-1 antitrypsin deficiency, which is a genetic condition. Also, smokers who get emphysema are more likely to get it if they have a family history of COPD. What are the symptoms of emphysema? At first, you may have no symptoms or only mild symptoms. As the disease gets worse, your symptoms usually become more severe. They can include frequent coughing or wheezing. A cough that produces a lot mucus. Shortness of breath, especially with physical activity. A whistling or squeaky sound when you breathe. Tightness in your chest. Some people with emphysema get frequent respiratory infections such as colds and the flu. In severe cases, emphysema can cause weight loss, weakness in your lower muscles, and swelling in your ankles, feet, or legs. How is emphysema diagnosed? Your healthcare provider may use many tools to make a diagnosis, a medical history, which includes asking about your symptoms. A family history. X-rays. X-rays are generally not useful for detecting early stages of emphysema. However, X-rays can help diagnose moderate or severe cases. Either a plain chest X-ray or a CAT, computer-aided tomography, scan can be used. Once the test is completed, the readings are compared to X-rays of healthy or normal lungs. Pulse oximetry. This test is also known as an oxygen saturation test. Pulse oximetry is used to measure the oxygen content of the blood. This is done by attaching the monitor to a person's finger, forehead, or earlobe. Spirometry and pulmonary function tests, PFT. This is one of the most useful tests to determine airway blockage. A spirometry or PFT tests the lungs volume by measuring airflow while a patient inhales and exhales. This test is done by taking a deep breath and then blowing into a tube that is hooked up to a specialized machine. These tests are compared to normal results from people of similar gender, age, height, weight, and ethnic background. Arterial blood gas. This test measures the amount of oxygen and carbon dioxide in blood from an artery. It is a test often used as emphysema worsens. It is especially helpful in determining if a patient needs extra oxygen. Electrocardiogram. ECGs check heart function and are used to rule out heart disease as a cause of shortness of breath. You might also talk to your doctor about whether testing for alpha-1 antitrypsin deficiency is appropriate for you. What are the treatments for emphysema? There is no cure for emphysema. However, treatments can help with symptoms, slow the progress of the disease, and improve your ability to stay active. There are also treatments to prevent or treat complications of the disease. Treatments include quitting smoking. If you smoke, quit. This is the most important step you can take to protect your lungs. It is never too late to quit. Your doctor can help you find the best smoking quitting method for you. Bronchodilator medications. These medicines relax the muscles around the airways. They are often used to treat asthma. Bronchodilators, given through handheld inhalants, produce more immediate results and have fewer side effects than oral medications. Anti-inflammatory medication. These medications reduce inflammation in the airways. However, long-term side effects of these drugs include osteoporosis, hypertension, high blood sugar, and fat redistribution. Oxygen therapy. Oxygen therapy is prescribed for patients whose lungs are not getting enough oxygen to the blood, hypoxemia. These patients can't absorb enough oxygen from the outside air and need to get more oxygen through a machine, a nasal catheter or a face mask. Lung volume reduction surgery. Lung volume reduction surgery involves removing a portion of diseased lung tissue, then joining together the remaining tissue. Doing this may relieve pressure on the breathing muscles and help improve lung elasticity, or stretch. The results of the surgery have been very promising. Not all patients with emphysema are candidates for this surgery. What are some tips for managing emphysema? The best way to prevent or reduce further problems is to prevent respiratory infections by practicing good hand washing methods, brushing and flossing teeth daily, and using an antibacterial mouth rinse after meals, keeping breathing equipment clean, keeping your house clean and free of dust, getting a flu shot every year, following a doctor-prescribed exercise program, avoiding irritants such as cigarette smoke, exhaust fumes, strong perfumes, cleaning products, paint/varnish, dust, pollen, pet dander, pollution. Pulmonary rehabilitation, which is a program that helps improve the well-being of people who have chronic breathing problems. It may include an exercise program, disease management training, nutritional counseling, psychological counseling, surgery, usually as a last resort for people who have severe symptoms that have not gotten better with medicines. There are surgeries to remove damaged lung tissue. Remove large air spaces, bullae, that can form when air sacs are destroyed. The bullae can interfere with breathing. Do a lung transplant. This might be an option if you have very severe emphysema. If you have emphysema, it's important to know when and where to get help for your symptoms. You should get emergency care if you have severe symptoms, such as trouble catching your breath or talking. Call your healthcare provider if your symptoms are getting worse or if you have signs of an infection, such as a fever. Can emphysema be prevented? Since smoking causes most cases of emphysema, the best way to prevent it is to not smoke. It's also important to try to avoid lung irritants such as second-hand smoke, air pollution, chemical fumes, and dusts.